Right now in Colorado, the COVID-19 vaccine is available to those 70 and older, plus some essential workers. But there's still a lot of confusion. So we asked 9Health expert Dr. Payal Kohli to answer some of the top questions.
Dr. Coley, always great to have you here on Coco. Well, now that there's a vaccine for COVID-19, there is a light at the end of the pandemic tunnel, but there's still a lot of confusion and questions that we have. So can you talk to us about how the vaccine works? And then, can you get COVID from it? Is it effective? All these questions.
Yes, Danny, I'm so excited that the vaccine is here because it really is going to be the beginning of the end of this pandemic. So let's talk about the three main vaccine candidates that are out there. So there's two here in the United States, the Moderna and the Pfizer vaccine. In my mind, essentially interchangeable vaccines with about a 94 to 95% efficacy at preventing severe symptomatic infection. They're both mRNA vaccines. They're both 2 doses, and they're both being launched throughout the country. Now, the Europe also has a third candidate, which is the AstraZeneca vaccine, which is a little bit different. It's a DNA vaccine. It's cheaper to make. It's only 1 dose, and the efficacy is about 70%. So some minor differences in the vaccines. But really, at the end of the day, it doesn't matter which one you get, as long as you get a vaccine, and that's what's most important. Now, the thing to keep in mind that a lot of people wonder is whether you can catch COVID from the vaccine. And that's what's so great about these vaccines. It is impossible to get the infection from the vaccine. Now, some people may feel under the weather after they get the shot, but that's just the immune system activating itself because the vaccine doesn't have any live virus in it. It just has the genetic blueprint for one part of the virus. That's a spike protein that's used to get into human cells. And essentially what it does is it shows your immune system how to fight it. So it shows it to your immune system so that it can learn how to make those antibodies. And that way, if it sees it again, it'll be ready. It reminds me of that scene from Home Alone where Kevin says, when those guys come back, I'll be ready.
Wow. Okay. So a lot of science that goes behind it, but obviously very important for us to know about. So, I just told you we're getting married here in a few months. And a big question on our minds is when can people expect to get this vaccine?
Yeah, so, unfortunately, the vaccine rollout has not gone as well as I had hoped. We had wanted 20 million doses by the end of 2020, and we've only given about 4.5 million doses. So that has been unfortunate. But I really am hopeful that we're going to continue with the momentum that has started. So right now, here in Colorado, we're in phase 1B, which means moderate risk healthcare workers, anyone over the age of 70, and first responders such as firefighters and police officers. In the springtime is really when we're going to see phase 2, which is going to be, people over the age of 60, as well as other essential workers like grocery store workers and teachers. And then for the general public, we're really looking at about the summertime in terms of that timeline. But the good news is, despite the logistical challenges with the vaccine launch, that timeline has really remained the same that it was a few weeks ago.
Okay, yeah, that's definitely good to hear. Now, there's so much information coming out from so many different sources. Where should people look for the information?
I think the best source of information, up to date, most accurate information is really going to be on the CDPHE website because they're really, designing much of this vaccination plan. Now, they are partnering with 9Health as well to administer some of these vaccines. So 9Health will also be a great resource, and that's 9healthfair.org, to try to get many of your vaccine questions answered as this partnership continues to blossom.
Once someone gets their vaccine, can they stop wearing that mask? Can they not have to worry about social distancing and all that?
Yes, this is a really important question, and I'm so glad you asked me. And the answer is absolutely not. You still have to wear that mask, socially distance, and wash your hands. And here are the reasons for that. So the first is, remember, the vaccines are not 100% effective. They're really good, but there's still a 5 to 6% chance that you could get severe symptomatic infection. There's also still possibly a chance, we don't know this yet, that you could have asymptomatic infection despite getting the vaccine. So you have to do it for your own sake. But the second and more important reason, and which I feel like may have gotten lost in some of the communication, is that if you get the vaccine, it's not clear yet whether you can still transmit the virus to others. So a lot of people say that I'm getting the vaccine to protect my family members or to be able to hug them again, but we don't yet know if the vaccine only protects the person getting the vaccine or it also protects those around them. So for those reasons, it's really important. The bottom line is we have to continue to wear those masks and socially distance until all of us get the vaccine.
Yeah, that's a great point because, like you said, so many people are just so ready to hug their loved ones, but we just are not sure yet. Okay, huge. So, Dr. Coley, as a healthcare worker, you've gotten your first dose of the vaccine. Why is it important for people to get?
It's so important because I feel like it is the only way that we're going to get our lives back to normal.
Okay, more on the war front. Well, we want to ask too, it was developed rather quickly, it seems. Is it something that we can trust?
Yeah, it's really important to know the difference between something that's been rushed and something that's been expedited. And in my opinion, this vaccine was expedited and not rushed. We really did do our due diligence with the science. We had multiple clinical trials going, and we threw all the resources that we had at this vaccine development, which is part of the reason why we could have done it so quickly. It's also important to know that based on the history of vaccinology, most of the side effects of the vaccines really do occur in the first few months of administration. So yes, we don't have long-term data on this vaccine, but history tells us that if something bad is going to happen, the overwhelming likelihood is that it might happen within a few months, which we already do have data on based on the clinical trials. So I feel extremely confident in the vaccine. I got it, and I'm certainly going to make all my family members get it.
Excellent. Well, Dr. Coley, as this, of course, develops and as we see more and more about, what's happening with the vaccine, we'll, of course, check back with you to see what new information you guys have.
9Health has been asked by the state to help deliver the COVID-19 vaccine to underserved communities. They are in the process of setting up vaccination centers and hope to help vaccinate additional communities as the vaccine becomes more available and more people become eligible to receive it. You can learn more about the vaccine at 9healthfair.org.